You can start, Dr. Hartl.
Thank you. Hello, everybody. My name is Roger Hartl. I'm the Director of Neurosurgery Spine at NewYork-Presbyterian, Spine, Cornell, and the Department of Neurosurgical Spine and Brain Surgery. I'm also one of the co-directors of the Center for Comprehensive Spine Care. And today I'm your host for our Spine Time webinar, where we will discuss acupuncture for neck and for brain pain problems, back pain problems. I'm joined today by Dr. Oleg Fabrikant and Dr. Victoria Chan Harrison, who we've been working with for a number of years now as part of the Comprehensive Spine Center, and who are both experts in acupuncture. So as most of you will know, the Center for Comprehensive Spine Care is located on 59th Street and 2nd Avenue. We have a team of interdisciplinary and multidisciplinary specialists who all work together to take care of patients with back and with neck problems, surgical but also non-surgical. So we have orthopedic surgeons, neurosurgeons, we have pain management specialists, we have physiatrists or sports medicine experts. We work with psychologists, we work with neuroradiologists, but we also work with, for example, the Center for Integrative Health at Weill Cornell, and with other affiliated specialists who help us not only diagnose, but then also treat patients with spine-related problems. And today, we have two wonderful specialists with us who are going to help us reveal the secrets and the promises and the facts about acupuncture for back and neck pain. We have Dr. Oleg Fabrikant here on the left side, who is the doctor of acupuncture and oriental medicine. He's a licensed acupuncturist, and he's part of Weill Cornell Medicine in the Department of Internal Medicine. On the right, we have Dr. Victoria Chan Harrison, who is an assistant professor of clinical rehabilitation medicine at Weill Cornell. So we have them both here live. You can turn on your camera, Dr. Harrison and Dr. Fabrikant. And again, thanks for being here today, and thanks for discussing with us acupuncture and how that relates to back and neck problems. I think we're going to start out with Dr. Fabrikant. Can you, you're at the Center for Integrative Health here at Weill Cornell, which is great. Can you tell us a little bit about what you do at the in integrative health, what that really means, and how acupuncture falls into that? And what is the role of acupuncture, and what else do you do to help patients with back and neck related issues?
Oh, great. Thank you, Dr. Hartl. Thank you for having me. I represent Integrative Health and Wellbeing. We are located at David Koch Building on East 69th Street. The program been around for about 5 years now. We have 5 integrative physicians, functional medicine, specializing in functional medicine. We also have a psychotherapist, we have a nutritionist, we have mind and body specialists. We do meditation. We also, prior to COVID, had Pilates classes, yoga, in addition to acupuncture. We had a nutritionist who is now joining the team at the end of the year. We have 3 acupuncturists currently on staff. And we are very happy to collaborate with your center. We do see a lot of your patients, and I hope they provide a good feedback and the results that we're able to provide for them. We do see quite a number of pain cases, whether it's chronic, acute, or related to surgery, recovery, etc. Acupuncture has a very good record treating pain. And as a matter of fact, in 2017, the College of Physicians had revised their recommendation and put acupuncture above pain medicine in terms of prescribing pain medication, and they would recommend to try acupuncture before moving into the opioids. That was part of the big revamp of the opioid crisis. We also offer group acupuncture for those who cannot afford individual treatments because of the lack of the insurance coverage. And the way the group acupuncture works, there are multiple people in the group. Again, during COVID restrictions, we're limited to a person per room, but before that, we were able to accommodate multiple people per room. And that was also part of something that we offer, and was very, very successful. So we're looking forward to restart the group acupuncture very soon. I'll tell a little bit about what group acupuncture looks like. Primarily, we use auricular points, the points on the ear, and those are very, very effective for treating pain in particular due to the proximity to the cranial nerves. A little bit of a background, the ear acupuncture is something that's been studied for the past 70 years. Great work was done by French physicians and German physicians, mapping out the areas of the brain that respond well to treating acupuncture needle.
Dr. Fabrikant, I'm sorry. We're going to go a little bit more into the mechanisms. I just wanted to give like an overview over, where acupuncture is in the spectrum of services that you guys have to offer. So we're going to get to the mechanisms and the indications, of course. If you don't mind, I'll just take over real quick. Obviously, all these things that I mentioned on these slides are extremely important in our patients. Remember, the patients that we see have sometimes chronic pain issues, back issues, neck issues. They've been through multiple, sometimes even surgery, and we've seen certainly here in the spine center that even though patients may have had treatment already, it is always good to know that there are options other than surgery and other than medication, and you've been very, very successful. I was wondering if maybe we could talk a little bit more detailed about acupuncture, like specifically the indications now, and then also, the pros, the cons, the risks. How do you figure out, that somebody is potentially a candidate, or somebody with back or neck issues is potentially a candidate for acupuncture? So I want to give this now to Dr. Harrison, and maybe tell us a little bit about what acupuncture really is and what are the indications in terms of pain.
Well, acupuncture mechanism action scientifically has been mapped out through research for pain conditions. It creates an analgesic effect with the insertion of the needles. And in particular, it has the body within the central nervous system, the peripheral nervous system, to release its own endogenous opioid peptides, which is you're creating your own pain chemicals. So that creates an immediate analgesic effect. But also some patients will actually downregulate, which is another fancy way to explain that the brain's perception of pain diminishes over time. So that is the rationale why some patients need acupuncture more than one session. So that's the logic behind having a series of sessions to decrease overall pain. It can be used in an acute setting as well as a chronic setting. The most published research involves low back pain in particular. The body research internationally encompasses more than 300 randomized control trials. It is second to neck pain as well, but also it's very well researched for osteoarthritis in general, particularly the knee and for headaches. And this is just an image of the acupuncture points that people frequently use for the spine. In this particular image, it is more for the cervical spine. And it's for patients who never had acupuncturists to visualize where needles can be inserted. More importantly, you do not necessarily need to have each and every area inserted with a needle. Basically, based on presentation, point selection will vary from person to person or even from week to week.
Can I ask you?
Mm-hmm.
Yeah. Dr. Harris, this is really fascinating. If I look at this, it has I think this particular picture here, talks about the gallbladder and then the green lines and the red lines. For a patient, and even for myself, I mean, how do you visualize it? What does this mean, and where does this come from?
Well, this is rooted in Chinese traditional medicine. They have developed basically acupuncture points have specific meridians that they travel. They actually have a particular organ system that controls a certain meridian. Each organ has its own physiology, which is different from Western medicine. So from the medical model, this is a completely different system of theory. So for example, the kidney meridian does not function necessarily the same way as we conceptualize in medicine. For example, the gallbladder actually travels on the lateral side of the body into the cervical region, into the temporal region. So a lot of these access points can be done peripherally, which is something that is surprising for most patients, that you would needle them in their lower limbs and their upper limbs to access the spine. So not only are needle points localized to the site of pain, but also distally in the limbs.
That's quite fascinating. And Dr. Fabrikant, you wanted to talk about the geographic origin, right, and the history of acupuncture. Maybe you want to tell us a little bit about that.
Well, sure. Acupuncture utilizes the energy system in the body that follows the pathways, which we call meridians. But what is meridian? Essentially, it is combination of the muscle, fascia, and the nervous system that encompasses a larger portion of the body. And as Dr. Harrison mentioned, each organ has its own meridian, and there are particular points located alongside that meridian that we can activate. And basically by inserting the needle, we're creating an electromagnetic signal that travels through the hypothalamus and to signals the pituitary gland to activate the production of the endorphins, and those are very natural painkillers, and also activates the indigenous opioid receptors. So we essentially can produce our own endorphins that neurotransmitters and neurohormones that control the pain. And that's how acupuncture works on the pain in particular. And the reason why we need multiple treatments is because consistency is important, because acupuncture has a cumulative effect. The multiple application of certain needles over the period of time stimulates that production of the endorphins. And that's essentially how acupuncture works. So for those who want to know if the acupuncture painful or not, just for you to understand, the acupuncture uses very thin needles that perception of pain is very minimal. It doesn't really damage the skin. It very gently spreads it. So the apprehension of actual treatment diffuses very fast once the patient experiences the first needle insertion.
And I think the interesting thing here is that it was really when Kissinger went to China in the 1970s, where one of his the journalists who joined him needed emergency surgery, right?
Correct. Yes.
And yeah.
That was in 1971, and there was James Ruston who had an appendectomy, and for pain post-surgically, he was treated with acupuncture. He became so fascinated because it worked so well on him. When he came back, he published an article in New York Times, and then essentially there was a pathway to the licensure in this country, whereas before acupuncture was not even licensed. So that article is a very big historical event for our profession.
Yeah, and I had a chance to talk to Dr. Kissinger about this, and he remembers this very vividly. And I think that was he had some funny anecdotes to tell about that that incident. That was obviously quite remarkable. I want to remind the audience, the listeners, patients, if you have any comments, any questions, please use your chat box and write a few words or sentences, and we'll be hopefully able to answer those. That's always welcome. So so we heard a little bit about the origin. We heard a little bit about the mechanism of acupuncture, but those lines, the meridians, do we know, how do we know that those are really crucial? I mean, in your practice, when you do acupuncture, is it really whether you're like a centimeter to the right or an inch to the left? Does that matter in your experience?
Well, it absolutely matters because that's
Like,
how
don't, if you ask a surgeon, you know the answer.
well,
But,
it's
but I'm just
kind of like
wondering.
that.
Yeah.
It's a little bit maybe more forgiving than the surgeons, but for the most part, it is very accurate and precise. And the reason for that is because there are particular receptors. It's a very interesting fact. I don't know if you know, but the Nobel Prize just went out a few weeks ago to a pair of researchers in the under the category of prize in medicine and physiology. They awarded it for studies of the trip channel responsible for sensations. And if you remember, the trip channels, it's an ion channel located in the tips of the sensory nerves that mediates the acupuncture signal. That's fascinating. This research that showed and proved that how acupuncture is being perceived was just awarded a Nobel Prize because acupuncture point is abundant in peripheral sensory nerve endings, and stimulating the needle changes the signals from the trip receptors, which subsequently leads to the changes in the spinal cord. So I thought that was fascinating that this body of research was just recognized by the Nobel Committee.
Also, acupuncture points are often in neurovascular rich locations. And also, if you look at the anatomy of some of these acupuncture points, they're actually in the motor points of some of the muscles. So if you do EMGs, a lot of these points are in those locations. So there's a lot of overlap between acupuncture points and neuroanatomy as well. So you could look at it in two facets, but certainly there is a idea of the de chi sensation. So when you do access a particular needle point, some patients will describe a very deep ache sensation when that needle is inserted, as well as a lot of times when you leave that needle, and you can actually see it on that slide in the low back, there is erythema that evolves whether you have the electrical stimulation there or not. And they have found from some ultrasound studies that the collagen vascular bundle actually gets a bit thicker and entwined in those areas. And they also found that the microsystem of the peripheral circulation increases in the perfusion of the tissue can increase in those areas. So there is a real physiology that's occurring on the peripheral level that is affecting a patient on the central level.
That's great. So we have a few questions come in, and one, I think Dr. Fabrikant, you kind of alluded to that earlier. How long do you suggest that people try acupuncture to see if it's helping with their pain? This is from Sally. How long? So a month, several months? It sounds like 1 or 2 treatment sessions alone are probably not enough.
Absolutely. First of all, individual response varies, but a typical course of acupuncture treatment is about 12 sessions, and that based off the most of the research that's been done. So the minimal course that I would recommend would be 12. Whether the patient responds on the first treatment and remains pain-free is just great, but I would still follow up to make sure it provides a long-lasting effect.
And is that once a week a session, or how often?
Well, given the constraints of the insurance reimbursement and the scheduling, once a week is a minimum. Ideally, based on the presentation, for example, if it's an acute scenario, I would recommend maybe even 2 to 3 times a week initially, but then we can follow the maintenance treatment and move on.
And what is it? And that goes to both of you, of course. What type of back pain, let's say somebody has back pain, sciatica, leg pain, what type of pain would you think is likely or is more likely to respond to acupuncture than others? What are your kind of, what's the indication to consider acupuncture in your practices?
Well, most of the randomized controlled trials in the acupuncture research body have excluded patients with lumbar stenosis. It's just, I think design-wise, it was easier to recruit patients that way. So I would have a caveat on that, but typically the data does support axial back pain with a limited radicular. In other words, less sciatic patients were recruited in that body of people with back pain, but that is not to say people with that component of neuropathic pain do not benefit from it. But your chances of improving much more quickly if it's less radicular and less widespread typically does better.
So that means, just for people so they understand, so axial back pain is really more localized in the lower back, low back pain without radiation into the legs. So that seems to be a little bit more favorable in terms of the success of acupuncture, correct?
Well, in my practice, we see a fairly good amount of radiculopathy and sciatica when people do have stenosis. So the very important factor to understand is there are two things. There's a root cause of the problem, which is the most important thing to understand. And there are two modes of treating it. We working on the pain perception, which is acupuncture is very, very good. And we're simply blocking the pain signal. And we also, because acupuncture increases the blood circulation, relaxes the muscle, along with physical therapy, can work on the root cause of the pain very successfully. So we see both.
Now, there's a question about post-spinal decompression surgery pain and acupuncture. And I remember a case that I had when I was seeing patients in the same location with Dr. Harrison. I remember a number of years ago, before we moved to the spine center here on 59th Street, I saw patients on Baker. And I remember, and I think it was Dr. Harrison, I remember a patient I operated on who had a Greek patient with a big family. And the surgery went very well. And he came back 3 or 4 days after surgery with terrible muscle spasms. I mean, literally the family was carrying him to the office on a stretcher because he couldn't walk because of spasms after surgery. And I remember, I don't know, Dr. Harrison, if you remember, I think you treated him and acupuncture, and he walked out and he was so happy. And I'll never forget that. That was like one of my, wonderful moments of seeing acupuncture work. Is that something that you've seen, that for muscle spasms, patients with severe muscle spasms, that acupuncture can be helpful?
Yes, it actually is a great indication for acute back pain, discogenic, even radicular. In an acute setting, the treatment response is very good, very favorable. A lot of times it's not something that a patient thinks of when they get acute back pain. A lot of times they will go to the emergency room or urgent care, or they'll see their family physician or internist. So we don't always necessarily see new cases, but those who are already knowledgeable about the spine center, people who are already savvy about spine care, those are other cases. But overall, for acute myofascial pain, it's a very good treatment modality.
Yeah, so and that kind of answers also the question. There's a question about how long after spinal surgery. I would say that depends obviously on the symptoms, but in that particular case, I mentioned if it's muscle spasms, which is not infrequent after any type of spinal surgery, I've used it in patients, and it's certainly a very, very good option. Now, help me to understand here in this picture. You can see, and you mentioned that before, they're using an electrode, they're stimulating these. What's the difference between, and when do you use acupuncture just with a needle, and when do you stimulate?
Well, sending an electromagnetic signal via the acupuncture needle bypasses the skin resistance, which is a very important factor in this. And as I said, that what is what's called the channel of the meridians is essentially a combination of muscle, fascia, and the nervous system. So muscle tissue is piezoelectric, and it acts like a rechargeable battery. That means that it holds an electrical charge, and it also generates electrons. So it's very important that we enhance the signal of acupuncture with electricity. And in my practice, I use a lot of electroacupuncture very, very successfully. So we can do the same thing manually. We don't need to use electric stimulation, but technology is there. There's a lot of body of the research that's been indicated that it's really, really a beneficial addition to the acupuncture treatment.
Well, that's great. Let's talk a little bit about risks and what's the worst case scenario? What can go wrong with acupuncture?
Well, infection is always for those who are immunocompromised. So for those who are on chemotherapy or people with neutropenia or some sort of hematological issue, that is something to be concerned of. But if you use an aseptic technique, in other words, gloves and wiping down with alcohol to clean the skin, most patients do well. The other thing is people who are on anti-coagulation, you can safely do acupuncture in those people on warfarin or medication similar to that. You may consider altering your needle depth when you're working with someone that way. Most side effects are really local, like bruising, skin color changes. There are those rare cases where some people do get a tissue injury or perforation of an organ. That is really incredibly rare, less than 1% internationally, and it really depends on your technique of needling. But overall, acupuncture is a very safe modality with very low side effects.
Yeah, when I look at these, this picture here of those needles, it looks a little scary, but they're obviously very small. I've heard about one case in my kind of like my surrounding, a friend of a friend who had a pneumothorax. Can that really happen?
It can. It is very rare though, and it also depends on the depth of the needle placement. I think also it's very important to find a position that is very comfortable for the patient. So people need to understand to not move with the needles. And also the technique of needling that is in the thoracic region can vary. So there are safe ways to do it. And it's all dependent on technique, but it has been reported, but very rare.
Now, our patients, obviously, they will all go to you guys, but if somebody doesn't have access, how do you find out, who's good, who's safe? Is there any kind of are there any credentials that acupuncturists have to fulfill to really be considered safe and effective?
Well, in order to obtain a license in any state, the candidate demonstrates that he's obviously graduated and passed what's called the safety needle, clean needle technique and all the precautions. The other addition, it would be the board certification, which is the National Board Certification for Acupuncture. And that stands for National Accreditation Commission, NCCAOM, and patient can go on that site and put a zip code to be connected to a list of practitioners in their area. So I just wanted to talk about the safety. The pneumothorax, the reason it's so low in this country in general around the world these days is because the needle itself changed. As you can see in the picture, the hypodermic needles, or the larger needles that used to be practiced, no longer exist, and they're very, very rare when you can damage using a very small needle, and the most important thing, the right technique.
Got it. Interesting. So it looks like there's a comment here. It looks like Medicare now pays for acupuncture. Is that correct?
Only for low back pain, unfortunately. Oh. Yeah.
In your experience, is acupuncture most successful for low back pain or for neck pain?
We treat everything. All sorts of pain responds well to acupuncture. So I wouldn't differentiate between the neck or the back. They very well, suited for acupuncture treatment.
And if I call you as a patient, as a potential patient, and I give you a history of my neck issues or back issues, what do you ask me to figure out if I'm going to be likely a responder to acupuncture? What is it that you would ask a patient, and what are you screening for?
Well, the first thing we would do is to rule out any red flags and why the pain is there to begin with. If there's any organic condition that we need to be addressed and need to be evaluated. Acupuncture very tactile, and it's important to see the patient. We also take the pulse. We look at patient's tongue. We palpate. We see what the muscle feels like and what it looks like. It's a complex diagnostic criteria that we look at. It's very hard to diagnose somebody over the phone, for example. However, for COVID, we were doing some telemedicine and some intakes, so we've perfected that technique a little better. But the red flags would be the first question to rule out, and then, of course, personal evaluation would be very important.
I also add with my evaluation, I go through from the Western medical model. Actually, we'll look at symptom history, chronicity. I will look at imaging, the burden of stenosis, the amount of nerve impingement. That just gives me an idea of how much involvement, how much in time expectations it may take for a person to improve. I like to just get a overall feel for a patient, and also their functionality, which is helpful for someone who's more sedentary. There could be more challenges, but the higher functioning individuals, regardless of the burden of stenosis, can be very favorable. So again, an individualized approach is very important, but I'd like to also superimpose that with some imaging and also history, and also prior treatment history is very helpful.
So it sounds like there's a comment here from Bill. If you need to know, if you want to know the specific area, I think what he means is the diagnosis. Is it disc herniation? Is it lumbar stenosis? It sounds like you want to know, but you don't require, let's say, for example, an MRI scan, or do you, before you start treating patients?
If I have one, I like that, because sometimes there are different pain generators. I like to take a look at whether it is more facet mediated. Is there a component of a myofascial component to the pain? Many people have different layers of their pain with different preferred pain patterns. And sometimes getting a good history, and as you work with someone, you can unravel those layers that they may experience. So that's why the imaging is helpful.
There's a question about functional spinal disorders or other disorders such as tumors, and I saw this before, and I was wondering, well, for tumors, I'm sure acupuncture is not the right treatment for a spinal tumor, of course. But then I thought a little bit more. I saw a patient, just as an example. I saw a patient a few weeks ago, and she's a 90-year-old lady, a wonderful lady, and she has a spinal tumor. And her symptoms are pain in a distribution of that particular. It's in the lumbar spine. Was the L5 or the S1 nerve that's affected by this tumor. And usually we would say, well, we probably should resect that tumor, and that can be done. But in her case, she's 90 years old. She's not that healthy. It's a huge tumor. So surgery is really something that we want to avoid. And her symptoms are really mainly pain related. So I was wondering, in somebody like that, would you consider, and let's say she doesn't want to do medication treatment, would you consider acupuncture, for example, to kind of control that pain? Would that be a reasonable indication?
It sounds like quality of life is important for right now in this particular scenario. So acupuncture is definitely going to affect the pain threshold, and it's going to help with quality of life. We never intend to treat tumors, and we do see a lot of oncology patients in our practice, but we focus mostly on the patient, on the symptoms, and we never really address the tumor per se.
So for quality of life issues, you would potentially treat that. Like I know you treat nausea, vomiting related to chemotherapy, for example, is a successful indication for acupuncture, correct?
Correct. Quality of life could be pain-free or reduction of pain, whether it's the fatigue, improvement in energy, improvement in appetite, reduction of dizziness, headaches. So acupuncture is a very broad spectrum that we can help with.
I can see somebody's raising their hand. I would ask you to submit your question or your comment in the chat box, please, because we can't, otherwise we wouldn't be able to address that. Another question, dry needling, what is that?
It's using a hypodermic needle, traditionally with physicians, where they will needle the myofascia and as well as the muscle to create a twitch response. Now, you could also dry needle using a higher gauge acupuncture needle. So the technique is similar. The depth will vary from practitioner to practitioners, but this is very similar to what you would get from a trigger point injection.
Just not to confuse, there's a lot of controversy about the term dry needling. Essentially, it is acupuncture. It is used on trigger points and very commonly these days. So the trick, as Dr. Harrison pointed out, is the technique that is used and the competency of the provider who's using it. Because that, when we cross the threshold of being more dangerous, potentially using hypodermic needle and not an acupuncture needle in terms of when we talked about pneumothorax. So again, there's very important distinction here. So, but essentially it is acupuncture, just different technique.
And since we're talking about techniques, is Suzanne has a question, is electronic acupuncture more painful than using needles?
Not necessarily. The only difference would be that the patient feels a slight pulsation. It's very similar to the TENS unit, except that the electrodes are clipped on the needle and bypassing the skin directly into the fascia in the muscle. And that's why there's a little bit of pulsation, but there's definitely not a discomfort or pain.
Great. I wanted to get a little bit into the science as well. And I put up a picture of a functional MRI scan. And I'm not going to ask you to interpret those images. This is just basically to set the mood. But there's really interesting data on how brain activity changes with acupuncture. Correct? Do you want to comment on that a little bit?
Sure. So there have been some functional MRI studies that look at the analgesic effect of acupuncture. So they've done side-to-side comparison of patients receiving a pain stimulus and a cortical activation and throughout the areas of the brain. So here you can see the limbic system, the thalamus, the cortex, and as well as compared to those who are actually receiving that painful stimuli in addition to getting acupuncture. And then you do see side by side, there's a downregulation. In other words, the areas that are active or in the imaging that light up diminishes with the acupuncture. So that was a way to show that there was a central effect from acupuncture rather than just a pure localized analgesic effect.
So up here, this is the MRI scan of a patient who is experiencing pain without acupuncture on top. Is that correct?
Let's see the slide. Yes, that's correct. And then the lower one is the person with acupuncture.
Interesting, huh? That's fascinating.
Yeah. So you can see the cerebral cortex is less activation.
Yeah. And there's a question here about acupuncture being the first line of treatment for back pain. Now, we see about 22,000 patients a year in the spine center here. And most of these patients have back and neck pain, of course. And obviously, you are acupuncturist, so you're probably biased. But would you say that in terms of the scientific evidence that we have, the clinical trials, cost effectiveness, if you put all that together, would you say it would make sense to have acupuncture as like a first line treatment for patients who come in like with common back and neck pain?
I think so.
Go ahead.
We're both in agreement.
Yeah. Well, this is why the College of Physicians had revised their guidance, and that's what exactly they were talking about, to be the first line of defense before people go and seek other more invasive treatments.
And then let's say we do that. How many sessions would you say? Try one session, see if you get a response, or how long would you what would be reasonable in terms of number of sessions?
I think we talked about it before, and that in my experience, I would say that 12 sessions is the course of the treatment, and this is substantiated by a lot of the studies.
But that means you could also, at the same time, you could obviously overlap with medication, I assume. You can take anti-inflammatories at the same time. So you couldn't do a combination of acupuncture. Would you also do then some type of exercise, physical therapy? Is that a reasonable?
Absolutely.
Yeah.
A lot of the research studies actually has shown there's two types of studies. There are those that use usual customary care versus acupuncture. There are studies that do no treatment compared to acupuncture. And overall meta-analysis has shown that if you have acupuncture in conjunction with physical therapy or medication usage, the outcome is much higher. So I don't think patients need to choose one or the other. It really should be thought of as another tool of conservative care. And in fact, in my practice, I often use acupuncture in conjunction with patients who are getting epidurals because you are limited to the number of epidurals you could have per year because of the high steroid doses. So sometimes acupuncture could be used to potentiate that energetic effect in between epidurals and to maintain quality of life. So it really depends. Each person will have their own goals. Some people want to minimize the medication use. Some people feel like that plateaued where conservative treatment, they do, and they want to add something in addition. So there's a lot of different indications and many different combinations.
That's great. So it's really, a multidisciplinary approach, and which in my mind seems to make a lot of sense. Now, before we finish up, and we have a few minutes maybe left here, but I just wanted to maybe get a few words from you about some of the related non-traditional interventions. Maybe there's cupping here, then there are these I don't even know what you call them, those little ear
seeds.
Yeah, ear seeds. So maybe a few words about how this relates to what you do. How does it relate to acupuncture, and just a few words of maybe advice?
Well, if you can look at the ear and the proximity to the cranial nerves, there's been a lot of studies of how many acupuncture points are actually located in the ear, and they've been mapped out not only by the points locations, but the frequency of electric stimulation that affects different parts of the brain. As a matter of fact, the United States military now uses the semi-embedded needles in the ear of the combative troops, and it's called a combat acupuncture. So battlefield acupuncture, and it has greatly improved the work on the pain. So that's mostly used for pain and anxiety, and sometimes even for weight loss and withdrawal, whether it's from narcotics or alcohol dependency. So it's one of the most used techniques these days. And I mentioned earlier, within the group acupuncture settings, that we use this a lot. Cupping as well. Cupping brings the blood to the surface, and it relaxes the muscles. It's a great perfusion of oxygen and blood to the tissue and relaxes the muscles greatly. So I use this quite frequently in our treatments.
Oh, here with the ear, are they just putting these little dots on, or is there any?
There are different
are
ways
those
of
needles?
doing it.
Are those needles that go in, or is this just?
There are two
surface?
different ways of doing it. There are some that come on adhesive tape, and you can literally tape it to the ear, and then you massage it. It doesn't penetrate the skin. The other way of doing it is semi-embedded needle. It's a small, tiny needle. Those are seeds. I think those are adhesives. Those are just being on some sort of an adhesive.
Right, those embedded needles are single-use sterile needles, which are important, and they are left. So when you use them, the patient leaves with those needles on, and as the skin granulates, those needles will slowly come off. So that's a caveat. That's something for someone who's more comfortable with acupuncture, who knows how to handle the seeds or the small little needles in the ear.
And you mentioned for the U.S. military uses this for what indication though? For pain or?
For pain, mostly for pain. The way it started was the Air Force colonel, who's a physician, and a lot of the airborne troops that were deployed, when they were landed with the parachutes, they would injure their knees and backs, and they had to complete the mission, and they were not allowed to take any painkillers at the time. So they were in pain. This physician studied acupuncture, and he created a protocol called the battlefield acupuncture. So he trains few people on the team to put this semi-embedded needles for pain, so they can complete the mission with less pain. And when they come back, then they can be addressed with other forms of medicine.
Well, all right. Well, it's 5:45. I think we'll probably wrap up. Do you have any final comments or anything you want to tell us before we conclude?
I think the closing remarks is to emphasize that multidisciplinary approach to spine care is superior, and that having many different collaborators, whether it be physical therapy, your acupuncturist, your surgeon, or pain or physiatry, is really the goal, to have people look at your condition from different perspectives to have a more holistic treatment plan.
I think that really sums it up very nicely, the multidisciplinary approach. I know, Dr. Harrison, you used to see patients here in the Spine Center. Hopefully we'll get you back here for a few sessions on a regular basis. And Dr. Fabrikant will continue to send you patients, and please stay in touch and come back one day. And we'll love to hear more about the work that you guys do in integrative health. It's really fascinating. It's so important. And thank you, everybody at home or where you are. And join us again in 2 weeks. We've got a very active schedule coming up. A lot of very, very interesting topics, all related to spine care, of course. And thanks for joining us. Have a wonderful evening and enjoy the evening. Thank you so much. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye.